The Marine commander was dying, and she wouldn't let anyone touch her. Major Alina Cross lay in the ICU bed, her vitals crashing, her breath shallow. 2 Navy doctors had tried. A senior physician assistant, even the hospital's chief of staff. She refused them all with a single glance, cold, final, absolute. The night nurse walked in at 200 hours. She didn't ask permission. She rolled up her left sleeve as she approached the bed. Major Cross's eyes widened. On the nurse's forearm was a tattoo, a black eagle, globe, and anchor, and beneath it, 4 numbers that hadn't been used since Helmand Province, 2012. The major grabbed the nurse's wrist. And for the first time in 3 days, she nodded. Naval Medical Center, San Diego. For 3 days, Major Alina Cross, a 42-year-old Marine Force Recon commander, had been refusing medical care. Post-operative from emergency abdominal surgery, she was dying. Her white blood cell count was climbing. Her fever spiked every 12 hours. She was going septic. But she wouldn't let anyone examine her surgical site. 2 Navy doctors tried. A physician assistant with combat experience tried. The hospital's chief of staff tried. She shut them all down with a look that could stop a staff sergeant at 20 paces. The hospital administration was frantic. Marine Corps headquarters was calling. A colonel from her unit had been turned away. But Major Cross had the legal right to refuse. The fact that she was exercising that right toward her own death didn't change the law. No one understood why. She'd been medevaced from a classified training exercise 3 days earlier with acute abdominal pain, underwent emergency surgery for a perforated bowel, and woke up completely uncooperative. The surgeons insisted the operation had gone well, but something was wrong and the major wasn't talking. Maya Reyes was a contract night nurse, 5 weeks at Naval Medical. Quiet, competent, forgettable. She moved through the ICU like a ghost, trauma experience, ICU certified, prior military health care listed vaguely as Department of Defense contractor. Nobody knew her name, nobody knew where she lived, nobody knew anything about her except that she was competent, quiet, and entirely unremarkable. That was the point. Maya was 34 years old, average height, with dark hair pulled back in a practical bun, and a face that people forgot 5 minutes after meeting her. She came in at 1900, worked her 12-hour shift, and left at 700. She'd been doing this for 10 years, moving every few months, never staying long enough for people to ask questions. At 2200 hours, Maya made her first round. She had 4 patients tonight. 3 were stable. The 4th was in room 412. Maya paused outside the door. Through the window, she could see Major Cross lying in bed, eyes open, staring at the ceiling. Her vitals were displayed on the monitor, heart rate elevated, temperature 101.9 and climbing. Maya didn't knock. She pushed the door open and stepped inside. Major Cross didn't turn her head. She didn't acknowledge Maya's presence. She just kept staring at the ceiling, her jaw set, her body language radiating the kind of control that came from years of leading people through situations where hesitation got you killed. Maya moved to the IV pump and checked the flow rate. She glanced at the monitor, then at the patient. Major Cross was a lean woman, her arms corded with muscle even in her weakened state. Her hair was short, military regulation, starting to gray at the temples. Her face was lined with sun damage and stress. She looked exactly like what she was, a career officer who'd spent more time in the field than behind a desk. Maya approached the bed with a thermometer and blood pressure cuff. She moved with calm efficiency, placing the cuff on the major's arm. The machine beeped softly. Blood pressure, 118/76. Not terrible, but not great for someone 3 days post-op. Maya reached for the stethoscope. The moment her hand moved toward the major's chest, Major Cross's left hand shot up and caught her wrist. Not violently, not aggressively, but firm, final. Their eyes met. Major Cross's gaze was steady, unblinking. It wasn't anger, it wasn't fear, it was assessment. She was reading Maya the way an operator reads a potential threat, looking for tells, for intent, for whether this person could be trusted or needed to be shut down. Maya didn't pull away. She didn't flinch. She just held the major's gaze and waited. After 5 long seconds, Major Cross released her wrist and turned her head back toward the ceiling. Maya stepped back, made a note on her tablet, and left the room without another word. At the nurse's station, Maya pulled up Major Cross's chart. The surgical notes were thorough. Emergency laparotomy, Repair of perforated sigmoid colon. No complications noted. The post-op course should have been routine, but the labs told a different story. White blood cell count, 18,000 and climbing. C-reactive protein elevated. All signs pointing toward infection that wasn't being adequately addressed. Maya scrolled through the notes from the day shift. Multiple attempts at wound assessment, all refused. The attending physician had documented, patient is alert and oriented but non-cooperative. It was a polite way of saying they'd given up. Maya closed the chart. She sat back and stared at the screen for a long moment. Then she stood, walked to the supply room, and pulled a specific item from the shelf. A package of adhesive foam dressing used for secure wound coverage in high-movement situations. It wasn't standard for post-op abdominal surgery. It was what you used in the field when someone needed to stay mobile and couldn't afford their incision to break down. She carried it back to room 412. This time she knocked once, then she entered. Major Cross turned her head slightly. Her eyes tracked Maya as the nurse approached the bed. Maya didn't speak. She set the dressing package on the bedside table. Then, slowly and deliberately, she reached down and rolled up the left sleeve of her scrub top. She turned her forearm so the major could see it clearly. There, just below her elbow, was a tattoo. It was small, precise black ink that had faded slightly with time. An eagle, globe, and anchor, the Marine Corps emblem. But beneath it, in numbers so small they'd be invisible from more than a few feet away, were 4 digits, 317. Marine Corps Occupational Specialty Code. But that wasn't what mattered. What mattered was the small insignia beneath the numbers, a stylized black dagger overlaid on a lightning bolt. Unofficial. Unauthorized, not something you'd find in any regulation manual. It was a unit marker, one that hadn't been used since 2012, one that didn't appear in any official records. One that only a very specific group of people would recognize. Major Cross's eyes locked onto the tattoo. Her entire body went still. Then slowly her hand moved. She reached out and grabbed Maya's wrist, not to push her away this time, but to pull her closer. She stared at the ink. Her jaw tightened. Her breathing changed. When she finally looked up at Maya, her eyes were different, still guarded, still wary, but no longer dismissive. "Who sent you?" Major Cross's voice was rough, barely more than a whisper. Maya held her gaze. "No one sent me, I'm just a nurse." "Bullshit." The major's grip tightened slightly. "That's a Helmand marker, MARSOC liaison unit, intelligence integration. That program was buried in 2012. Maya didn't confirm or deny. She just looked at the major with the same calm she'd shown since walking into the room. "I need to see your incision." Major Cross stared at her for another 10 seconds. Then slowly she released Maya's wrist and nodded. Maya pulled on gloves. She moved to the side of the bed and carefully lifted the hospital gown. The dressing covering the surgical site was standard post-op, white gauze, secured with tape. But around the edges, Maya could see what the day shift had missed. The skin was inflamed, angry, with streaks of darker discoloration radiating outward, and there was a smell. Faint but unmistakable to anyone who'd worked trauma in austere environments. Infection, not surface level, deep. Maya carefully pulled back one corner of the dressing. What she saw underneath made her jaw tighten. The incision was clean along most of its length, but at the lower edge there was a second wound, smaller, irregular. Partially concealed by the surgical site but distinct from it. It wasn't from the surgery. It was something else, something the major had been hiding. Maya looked up. Major Cross was watching her, eyes hard. "This isn't going to heal on its own," Maya said quietly. "I know. It needs to be debrided properly." "You're going septic." "I know." "Then why?" "Because it can't go on record." Major Cross's voice was flat, final. "That wound doesn't exist. If it gets documented, people die." "Do you understand?" Maya understood. She'd been in situations where the official story and the real story existed in two different worlds, where documentation was a weapon. Where the wrong note in the wrong chart could burn an entire operation and everyone still running it. She recovered the wound carefully. She disposed of her gloves. Then she looked at the major and said, "I'll be back in an hour." "With what?" Maya didn't answer. She just walked out of the room, pulling her sleeve back down over the tattoo that hadn't seen daylight in years. Maya didn't go back to the nurse's station. She walked past it, through the double doors to the staff locker area. The hallway was empty. She opened her locker and pulled out a small black backpack she'd never opened on hospital property. Inside was a phone, not the smartphone she carried for work. This one was older, a basic flip model with no apps, no GPS, no data connection, just calls. She powered it on. The contact list had 4 entries, all labeled with single letters. She scrolled to the third one, marked simply as R, and stared at it for a long moment. She hadn't used this phone in 18 months. The last time they'd crossed paths was at a memorial service in Arlington. They made an agreement that day, no contact unless it was life or death. This qualified. Maya pressed the call button. It rang twice. Yeah. The voice on the other end was male, flat, cautious. It's Ray's. A pause, then, I thought you were out. I am. Then why are you calling? I need a supply drop, medical. Sterile field grade, nothing that traces back to hospital inventory. Another pause, longer this time. Where are you? San Diego. Naval medical. You're working at a Navy hospital and you need off-book supplies. What's the situation? MARSOC officer, hidden wound, can't go on record, going septic. I've got maybe 24 hours before she crashes. Why doesn't she just tell her command? Because the wound's from an op that doesn't exist. If it gets documented, it burns active assets. The line went quiet. Maya could hear movement on the other end, footsteps, a door closing. When R spoke again, his voice was lower. How bad? Bad enough that I'm calling you. Christ raise, he exhaled slowly. What do you need? Debridement kit, broad-spectrum antibiotics, IV grade, irrigant, suture supplies, sterile drapes. And I need it in 6 hours. 6 hours is tight. It's what I've got. R was silent for a moment. Then, there's a 24-hour pharmacy in Hillcrest, 3rd Street near the bridge. Go to the back loading area at 400. There'll be a blue cooler behind the dumpster. Everything you need will be inside. You've got 30 minutes to grab it before it gets pulled. Anything I need to know, don't get caught, and raise, this clears your tab, we're even after this. Understood. The line went dead. Maya powered off the phone, locked the locker, and returned to the ICU. She finished her rounds methodically, her face neutral, her hands steady. At 3:45, she told the charge nurse she was taking her break. She walked out the side entrance and crossed the parking lot to her car, a 10-year-old Honda Civic with primer spots on the hood. Unremarkable, forgettable, she drove to Hillcrest. The streets were empty at this hour. She found the pharmacy on 3rd Street and pulled around to the back alley. The dumpster was exactly where R had said it would be. Behind it was a blue cooler with a bungee cord securing the lid. Maya grabbed it and carried it back to her car. She didn't open it. Not here. Not yet. She drove back to Naval Medical and carried the cooler inside through the side entrance. No security cameras on that door. She'd checked her first week. Inside, she opened the cooler. Everything was there. Sterile surgical kit, debridement tools, irrigant solution, broad-spectrum IV antibiotics, 2 types, both heavy-duty, suture supplies, sterile drapes. Even surgical gloves in her size. R had come through. Maya repacked the supplies into a hospital equipment bag, disposed of the cooler in the biohazard trash compactor, where it would be incinerated by morning, and carried the bag into room 412. Major Cross was still awake. She looked worse than she had an hour ago. Her fever had climbed to 102.3, and her skin had taken on a grayish pallor. But when she saw the equipment bag, her expression sharpened. You got it. I got it. Maya set the bag on the tray table and started pulling out supplies. But I need to be clear about something. What I'm about to do isn't protocol. It's not sterile field surgery. It's field medicine. It's going to hurt, and there's no anesthesiologist standing by if something goes wrong. I've had worse. I'm sure you have. But if this goes bad, I can't call for help without documenting what I'm doing, which means if you crash, you die. Do you understand? Major Cross met her eyes. I understand. Maya nodded. She locked the door. She pulled the privacy curtain. She dimmed the lights. Then she scrubbed her hands, dried them with sterile towels, and pulled on the surgical gloves. She moved to the bedside and carefully removed the dressing covering Major Cross's abdomen. The surgical incision was inflamed, the tissue around it angry and swollen. But it was the second wound, the hidden one, that concerned her. It was roughly 2 inches long, irregular, partially scabbed, but clearly infected. The surrounding tissue was hot to the touch. When Maya applied gentle pressure, a small amount of purulent drainage seeped out. How did this happen? Maya asked quietly. Training accident, Major Cross said through gritted teeth. Live fire exercise, shrapnel, small piece lodged near the incision site. I pulled it out myself. When? 2 days before the surgery, Maya swore under her breath. You had a foreign body wound and then went into abdominal surgery without telling anyone. I couldn't. The exercise was black side. If I reported the injury, it would have triggered an investigation. People would have asked where I was, what I was doing. I couldn't risk it. Maya didn't argue. She'd been in situations where operational security overrode personal safety. She understood the calculus. She opened the debridement kit and pulled out a scalpel. This is going to hurt. I know. Maya started working. She irrigated the wound first, flushing out the debris and drainage. Major Cross inhaled sharply but didn't make a sound. Maya used the scalpel to carefully remove the necrotic tissue, small, precise cuts, peeling away the dead material to expose healthy tissue beneath. Blood welled up. She irrigated again. The Major's breathing was shallow, controlled, her jaw locked tight. It took 20 minutes. When Maya was finished, the wound was clean, the infection visibly reduced. She irrigated one final time, then packed the wound with sterile gauze and covered it with adhesive foam dressing. It would hold, not perfectly, but well enough. She hung the IV antibiotics and programmed the pump. Broad-spectrum coverage. High dose. It would hit the infection hard. When she was done, she stripped off her gloves and stepped back. Major Cross was pale, her face slick with sweat, but her eyes were clear. You did good, Maya said quietly. The Major didn't respond immediately. She just lay there breathing, letting the pain settle. Then she said, You've done this before. Yeah, where? Maya started packing up the supplies. Places that don't have names. How many times? Enough. Major Cross watched her work. You're not just a contract nurse. Tonight I am. The Major was silent for a moment. Then what's your real name? Maya paused. She looked at the Major, and for the first time she let a fraction of the truth show. Rays, Sergeant Maya Rays, Marine Corps. Force Reconnaissance, Intelligence Integration. Helmand Province, 2011 to 2013. Honorable Discharge, 2014. Everything after that is classified. Major Cross nodded slowly. Why did you leave? Because I was told to. By who? By people who decided I knew too much to stay in uniform. The Major's expression hardened. They burned you. They gave me a choice. Take the discharge and disappear, or stay in and spend the rest of my career behind a desk where they could watch me. I chose to disappear. And now you're here. Now I'm here, Maya agreed. She finished packing the equipment. Get some sleep. The antibiotics will start working in a few hours. By morning, your fever should break. Rays, Maya stopped. Thank you. Maya didn't turn around. She just nodded once and left the room. Major Cross's fever broke at 6:20 hours. Maya checked the monitor, temperature down to 99.1 degrees. The antibiotics were working. At 700, Maya gave report to the day's shift and clocked out. She drove to a diner 3 miles from the hospital and sat in a corner booth, buying time. Waiting to see if anyone would notice what she'd done. Waiting for the knock that would mean someone had started asking the wrong questions. It didn't come. That night, Maya returned to the hospital for her shift. Room 412 was quiet. Major Cross was awake, sitting up slightly, her color significantly better. How are you feeling? Maya asked. Better, fever's down, that's good. It's more than good, it's a miracle according to the day team. Dr. Brennan came by this morning. He seemed surprised I was still alive. Major Cross paused. He wanted to examine the surgical site. I refused. Did he push? He tried. I told him I'd sign an AMA discharge if he didn't back off. Maya pulled off her gloves. Then we keep the dressing in place and hope the infection clears before he forces the issue. And if it does, then you're going to have to make a choice. Your career or your life. Major Cross's jaw tightened. It's not that simple. It never is. Major Cross's voice stopped her as she moved toward the door. There's something else. I got a call this afternoon from my XO. There's been chatter, questions from higher up about why I'm still in the hospital, about why I'm refusing care, about whether I'm psychologically fit for duty. Maya's expression didn't change, but internally she felt the situation shift. What kind of questions? The kind that come before an investigation. The kind that come before they pull my security clearance and start digging into where I've been and what I've been doing. If they investigate, they'll find the training exercise. They'll find the discrepancies in the timeline. They'll start asking questions I can't answer. And people who are still in the field, people who were with me, will get burned. Maya processed that. How long do you have? 72 hours, maybe less. My co is flying in tomorrow to assess the situation personally. If I don't cooperate with medical treatment by then, he's pulling me out of here and putting me in front of a fitness board. Can you stall him? Maybe, but not for long. I need this wound healed enough to pass inspection, or at least hidden well enough that it doesn't raise flags. Can you do that? Maya looked at her for a long moment. The infection was clearing, but wounds didn't heal in 3 days. The best she could hope for was containment, keeping it clean and covering it well enough that a cursory visual inspection wouldn't catch it. But a thorough medical examination. That was a different story. I can try, Maya said. But if your co orders a full physical evaluation, there's nothing I can do to hide it. Then I'll make sure he doesn't order one. The situation was deteriorating. Major Cross had maybe 3 days before the Marine Corps forced her hand. And if they started investigating, they wouldn't just look at her. They'd look at everyone around her. Including the night nurse who'd somehow managed to turn around a dying patient without any documented intervention. At 2300 hours, Dr. Brennan walked onto the unit. He was the chief of surgery, which meant he had the authority to override just about anyone in the building. He walked directly to Maya. Nurse Reyes, she looked up. Yes, sir. I want to talk to you about Major Cross. Her labs improved significantly overnight. White blood cell count dropped from 18,000 to 12,000. C-reactive protein down by 40%. Fever resolved. That's not a gradual improvement. That's a dramatic turnaround. And it happened on your shift. Sometimes patients respond well to treatment, Maya said evenly, except she wasn't receiving treatment. She refused everything except maintenance fluids and basic antibiotics, which means something else changed. Did you administer any medications that aren't in the chart? No, sir. Did you perform any procedures? I provided standard nursing care. Vital signs, IV management, patient comfort measures. And nothing else? Nothing else. Dr. Brennan studied her for a long moment. Maya didn't look away. Finally, Dr. Brennan said, I'm ordering a wound assessment tomorrow morning. Major Cross can refuse all she wants, but I'm the chief of surgery, and I have the authority to override patient refusal if I believe there's a medical emergency. If that wound is infected, I'm taking her back to the OR whether she consents or not. Understood, sir. Maya had maybe 12 hours before the Major's wound was exposed. 12 hours before everything unraveled. She returned to room 412. Major Cross was awake, staring at the ceiling. Brennan's ordering a wound assessment tomorrow, Maya said. He's not giving you a choice. The Major closed her eyes. Shit. There's one option: you leave tonight, AMA discharge. You walk out before they can force the exam. And go where? I'm active duty. I can't just disappear. The moment I leave, they'll issue orders to bring me back, and then the investigation starts anyway. Then you need to make a decision. Let Brennan examine the wound, document it, and deal with the fallout, or tell your command the truth and hope they protect you. They won't. The op I was running, the one that caused this, it was off-book. Authorized at the highest levels but completely deniable. If it comes out, they'll burn everyone involved to protect the mission. Including me? Then what do you want me to do? The Major looked at Maya. Can you clean it up enough to pass a visual inspection? Maybe, if he doesn't probe it, if he doesn't apply pressure. If he just looks and moves on. That's not much of a chance. It's the only chance you've got. Major Cross nodded. Do it. Maya checked the hallway, then locked the door. She examined the wound under the overhead light. It looked better, less inflamed, less drainage, the tissue starting to granulate. But it was still visible, still distinct from the surgical incision. She cleaned it carefully, applied a thin layer of tissue adhesive to the edges to help it blend with the surrounding skin, and covered it with a transparent dressing that would make it harder to see the irregularity. It wasn't perfect, but it was the best she could do. That's it. If Brennan looks closely, he'll see it. If he's in a hurry, he might miss it. Then I'll make sure he's in a hurry. If this goes bad, the Major said, you need to disappear. Don't wait. Don't try to cover for me. Just go. If they connect you to this, they'll dig into your background, and whatever you've been hiding will come out. Maya didn't answer. She just turned and walked out. At 400 hours, Maya stood in the parking lot and pulled out the flip phone. She scrolled to a contact she'd never called before, marked simply as L, and dialed. It rang 4 times. Then a voice answered, female, cautious. "Who is this?" "Ray's Hellman 12, a pause. "I thought you were out." "I am. But I need a favor." "What kind of favor?" "The kind that makes a problem disappear before it becomes an investigation." The woman was silent for a moment. "How big is the problem?" "MARSOC officer. Hidden wound from a black side op. Hospital, S about to force a medical exam that will expose it. If that happens, active assets get burned. And you're involved because I'm the one keeping her alive." Another pause, longer this time. "You're asking me to interfere with a military medical investigation. I'm asking you to protect operational security. That's not my job anymore, Rays, and it's not yours either. I know. But if you don't help, people die, and you know it." The line was quiet. Finally, she said, "Give me the officer's name and unit." "Major Alina Cross, Marine Corps Force Reconnaissance. Currently at Naval Medical Center, San Diego. I'll make some calls, but Rays, this is the last time. After this, you're on your own." "Understood." The line went dead. Maya didn't know if it would work, but it was the only card she had left to play. At 700, she gave report to the day shift. At 7:20, Dr. Brennan arrived on the unit. And at 7:45, Maya walked out of Naval Medical Center, knowing that by the time she came back tonight, everything would either be resolved or completely destroyed. Maya drove to a coffee shop and waited. At 11:37 hours, her phone buzzed. A text message from an unknown number, issue contained. Officer cleared for duty. Investigation closed. Delete this message. Maya read it twice, then she deleted it. Major Cross was safe. For now. That evening, Maya returned to the hospital early. The charge nurse handed her the assignment sheet. The outgoing nurse briefed her. Major Cross had a big day. Right before Dr. Brennan's exam, she got a call from some colonel at Marine headquarters. "Next thing we know, Brennan's being told to stand down. The major's been cleared for discharge tomorrow. No exam, no questions. Just pack her up and send her back to Pendleton." Maya entered room 412. Major Cross was sitting up in bed, dressed in a Marine Corps PT shirt. Her color was good. Her eyes were clear. "You made another call," the major said. It wasn't a question. Maya closed the door. "I don't know what you're talking about." "Bullshit." 3 hours after Brennan tried to force the exam, I get a call from a Marine colonel I've never heard of telling me the investigation is closed, and I'm cleared for duty. That doesn't happen without someone pulling strings at a very high level. Sometimes things work out. Not like this. "Who did you call?" "Someone who owed me a favor." "What kind of favor?" "The kind you don't ask questions about." The major studied her. "You burned a contact to protect me. That contact could have been your safety net. Someone you could call if you ever needed to disappear. And you used it on me instead. You needed it more. That's not the point." "Then what is the point?" Major Cross held her gaze. "The point is that you just made yourself more vulnerable to save someone you barely know, and I need to understand why." Maya set down the tablet. She pulled up a chair and sat, her voice low. "In 2012, I was embedded with a MARSOC unit in Helmand Province. We were running intelligence integration. One night we got hit during an exfil. Ambush. 3 Marines went down in the first 30 seconds. I was the only medical asset on site. I kept them alive long enough to get them on the helicopter. Barely. One of them coded twice before we reached the field hospital, but they all made it. All 3. One of those Marines was a staff sergeant named Vega. He wrote a letter to my command afterward. Said I saved his life, said I deserved a medal." She paused. "Did you get one?" "No, because 2 weeks later the operation we were supporting went sideways. Asset got compromised. Intel got leaked. People died. And someone decided I'd seen too much, knew too many names, had too many connections to assets who were still active. So they gave me a choice. Take an honorable discharge and disappear. Or stay in and spend the rest of my career in a windowless office where they could control what I knew and who I talked to. You took the discharge. I took the discharge. And for 10 years I've kept my head down, worked contract nursing, moved every few months, stayed off the grid, didn't reconnect with anyone from that life. Until now. Until now, Maya stood. You asked why I'm doing this. It's because I know what it's like to be burned for doing the right thing. I know what it's like to have your service erased because it's inconvenient. And I know what it's like to watch the people you bled for pretend you never existed. I couldn't save my own career, but I could save yours." Major Cross was silent for a long moment. Then she said, "Staff Sergeant Vega. He's a gunnery sergeant now, stationed at Lejeune, still on active duty. He's got a reputation, solid operator, leads from the front. He talks about Helmand sometimes, about the medic who saved his fire team. He doesn't know your name, it was redacted from the official reports. But he knows you existed." Maya felt something tighten in her chest. "You saved his life," Major Cross said quietly, "and now you've saved mine." "That means something, Rays. You're being discharged tomorrow. That means we need to do one final dressing change tonight." The Major was silent. "Then I'm putting in a request for a medical liaison officer, someone to coordinate care for Marines transitioning out of combat deployments. It's a civilian position, contract-based. Requires trauma experience and security clearance." Maya looked at her. "I don't have an active clearance." "You could. If someone with enough rank requested it." "Why would you do that?" "Because you're wasted moving between hospitals every few months, because you have skills most people don't, and because I owe you. I can't undo what happened to you in 2012. I can't give you back what they took, but I can give you a way back in. A way to use your training without having to hide who you are." Maya felt something she hadn't felt in years, possibility, but it was dangerous. "I'll think about it." "Don't think too long. The offer expires when I leave tomorrow." The rest of the shift passed without incident. At 300 hours, an incoming trauma call came in. Mass casualty incident from a vehicle accident. The first patient arrived, a young Marine early 20s with severe chest trauma. Punctured lung, fractured ribs, bleeding internally. Maya took him as her patient. She managed the chest tube, titrated the vasopressors, monitored his vitals with calm efficiency. When he looked at his face, young, pale, unconscious, she thought about Vega, about Helmand. About the Marines she'd kept alive in situations far worse than this. At 5:30, the young Marine opened his eyes. He was disoriented, in pain, trying to pull at the tubes. Maya moved to his side and spoke quietly. "You're at Naval Medical. You were in an accident. You're going to be okay." He stared at her, breathing rapid and shallow. "My team? Your team is fine. They're being treated. You're safe." His eyes were wide with something beyond pain, fear, guilt, the weight of survival. Maya had seen that look before. She placed a hand on his shoulder, firm. "Grounding, you did your job, now let us do ours." The young Marine held her gaze for a moment. Then he nodded and closed his eyes. At 700, Maya clocked out and walked to her car. The sun was rising over the city. She sat in the driver's seat, staring at the hospital. Major Cross's offer was still on the table. A way back in, a way to stop running. For the first time in 10 years, she was considering it. The next night, Maya returned to Naval Medical. Room 412 was empty. Major Alina Cross had been discharged that morning, cleared for light duty, and returned to Camp Pendleton. At 2100 hours, one of the unit clerks approached Maya with an envelope. "This was left for you earlier. A Marine officer dropped it off." Maya opened it in the staff bathroom. Inside was a single sheet of paper and a business card. The letter was handwritten. "Rays, the liaison position is real. If you're interested, the contact information is below. The job is yours if you want it. No questions asked about the gap in your service record. No scrutiny of where you've been. Just a chance to do what you're good at without looking over your shoulder. I meant what I said. You saved my life. More than that, you protected people who are still in harm's way. That matters. It matters more than the bureaucrats who burned you will ever understand. You don't owe me anything. But you owe it to yourself to stop running. Semper Fi, Major Alina Cross." Maya folded the letter and tucked it into her locker. She didn't throw it away. But she didn't pull out her phone to make the call either. Not yet. At 2300 hours, Dr. Brennan walked onto the unit and stopped at the nurse's station. "Nurse Rays, I wanted to talk to you about Major Cross. I don't know what you did. I don't know who you called or what strings you pulled. But I know that Major Cross is alive because of you. And whatever protocol you violated, whatever rules you bent, it was worth it. I'm not going to report this. I'm not going to investigate further. Your contract here ends in 2 weeks. If you decide to extend, I'll approve it. No questions asked. You're good at what you do, Rays. It would be a shame to lose you." He walked away before Maya could respond. 2 offers in one night. 2 chances to stop moving. At 18:30 hours the next evening, Maya was checking an IV pump when she saw a figure in marine dress blues standing near the entrance to the ICU. Major Alina Cross. She looked different in uniform, formal, composed, every inch the officer she was. Maya walked over. "I thought you were at Pendleton." "I am. I had a meeting at headquarters this afternoon." "Figured I'd stop by on my way back. Did you get my letter?" "I got it. And," Maya hesitated, "I'm thinking about it. Don't think too long." "The position gets posted officially next week." Major Cross reached into her pocket and pulled out something small. She held it out. "I wanted to give you this." Maya looked down. It was a challenge coin, black metal with gold edging. On one side was the Marine Corps emblem, on the other, Semper Fidelis, Helmand 2012. "I had it made for the people who served in that unit. The ones who didn't get official recognition because the mission didn't officially exist. There are only 15 of these in existence. You earned one." Even if no one ever acknowledged it. Maya took the coin. It was heavier than she expected, solid, real. A physical reminder that she had existed, that her service had mattered, even if it had been erased from every official record. "Thank you," Maya said quietly. Major Cross extended her hand. Maya shook it, a firm, professional grip that carried the weight of shared experience. "I hope you take the job, Rays, but if you don't, I understand. Sometimes the hardest thing to do is stop running." She turned and walked away. Maya watched her go, then looked down at the coin in her palm. She turned it over slowly, feeling the engraved letters. Semper Fidelis, always faithful. The next morning, Maya finished her shift and drove home. She sat at her small kitchen table and pulled out the business card Major Cross had given her. She stared at it for 10 minutes, then she picked up her phone and dialed the number. It rang 3 times. "Marine Corps Liaison Office." Maya took a breath. "My name is Maya Rays. I was told to call about a contract position." "One moment, please." There was a pause, then a different voice, older male, calm. "Ms. Rays, we've been expecting your call." Major Cross spoke highly of your qualifications. "Are you interested in the position?" Maya looked around her apartment. The bare walls, the minimal furniture. The packed bag in the closet that was always ready for the next move. She thought about the young Marine she'd stabilized, about Major Cross walking out alive, about Vega at Lejeune still telling stories. She thought about 10 years of running, 10 years of hiding. 10 years of pretending she didn't miss the work, the purpose, the feeling of being part of something larger. "Yes," Maya said, "I'm interested." "Excellent, I'll send you the paperwork." "When can you start?" 2 weeks, I need to finish my current contract." "That works, welcome aboard, Ms. Rays." The call ended. 2 weeks later, Maya finished her last shift at Naval Medical Center, San Diego. She turned in her badge, cleared out her locker, and walked out at 7:20 hours. The morning was clear, the sky bright with early light. She didn't look back. She drove to a small office building near the naval base where the Marine Corps Liaison Program operated. A staff sergeant in dress blues escorted her to a conference room. Major Cross was waiting. They talked for 2 hours. The job was exactly what Major Cross had described: coordinating medical care for Marines transitioning out of combat deployments, interfacing between military and civilian healthcare systems, ensuring continuity of care for people who'd given everything. It was meaningful work, important work, the kind of work Maya had been trained to do. When the briefing was over, Major Cross walked Maya to the door. "You made the right choice." "I hope so." "You did, and Rays, you don't have to hide here. People know you have experience. They don't need to know the details, just be good at your job." "That's enough. Thank you, ma'am. Semper Fi, Rays. Semper Fi." Maya walked out and stood in the parking lot for a moment. The sun was high now, warm on her face. She looked down at her hands, the same hands that had treated casualties in Helmand, that had saved Major Cross's life, that had spent 10 years moving from one temporary assignment to the next. They didn't look any different, but they felt different, steadier, grounded. Maya drove to her new apartment, a 1-bedroom in National City, a 6-month lease she'd signed 2 days earlier. It wasn't much, but it was hers, for now, maybe longer. She unpacked slowly, clothes in the closet, books on the shelf. The challenge coin from Major Cross on the small table by the door where she'd see it every time she left. When she was finished, she sat on the edge of the bed and pulled out her phone. She scrolled to her sister's name and stared at it for a long time. Then she typed a message. "Hey, it's Maya. I know it's been a while. I'm in San Diego now. Took a job with the Marines. I'd like to talk if you're free sometime." She hit send before she could change her mind. 3 minutes later, her phone buzzed. "I'm free this weekend. Come visit. The kids would love to see you." Maya read the message twice. Then she typed back, "I'll be there." She set the phone down and looked around the apartment. It wasn't home, not yet, but it was a start. For the first time in 10 years, Maya Reyes allowed herself to believe that maybe she could stop running. Maybe she could stay. Maybe she could finally let herself be found.